Hi, I'm Dr. Brian Luenda, and I want to introduce myself. I am a radiation oncologist. I'm an integrative oncologist. I practice functional medicine, medical acupuncture, and putting all of this together, a lot of it comes into a sphere that we're talking about these days called biohacking. And I guess you could call me a biohacker. There's a number of things that I like to recommend to my patients to do to hopefully improve their cancer outcomes, as well as improve their quality of life. And there's a lot of things that I'll be teaching on this particular website that you can come either see me in the clinic to learn about, or you can learn about remotely through my website, or as well as through consultations that I do through Skype and other video platforms. So welcome, and I look forward to teaching you about biohacking. So what is biohacking? This is a question that I get often. And biohacking is another way of saying the quantified self. It is where I might be using technologies such as heart rate variability monitors or sleep tracking devices, activity monitoring devices, or using lab tests to look at underlying physiology. There are recommendations regarding lifestyle modification. And basically, it's putting all of these things together in order to try to improve somebody's overall health outcomes and quality of life. So that's generally biohacking in a nutshell. So how can biohacking actually be useful for an individual who doesn't, say, have cancer? What I usually say is that we want to reduce somebody's risk of developing cancer, and there are a lot of ways that we can do that through lifestyle and through wearable technologies in order to help guide somebody in using basically evidence-based recommendations on their own physiology, as well as things that we know from the literature that are associated with lower risks of developing cancer, cardiovascular disease, diabetes, and dementia. And all these things are really linked. As one example, we can look at activity, and you can use activity monitors that track your number of steps that you're taking. We can use sleep tracking technologies to basically figure out how much deep sleep you're getting, which correlates also to, say, systemic inflammation, one of the key driving factors for cancer, and a number of other things that we do to help change the underlying physiology, making the body less conducive to developing cancer. Similarly, if you have cancer, you can use biohacking in order to hopefully improve your cancer outcomes and your quality of life. And using these wearable technologies and lab testing, lifestyle modifications, we can also guide you in terms of things that we know that may improve somebody's outcomes. As an example, fasting, which is a simple way of basically reducing caloric intake and decreasing insulin levels and sugar levels, all of which has been shown to improve cancer outcomes in a number of different studies. This is something that I could use a blood sugar monitor, for example, to help track to see how somebody's blood sugars are doing, so we can look at fasting blood sugar levels. Additionally, activity can be monitored so that we can figure out how much activity somebody's getting, say this month in comparison to next month. And we know that physical activity is also correlated with stress, it's correlated with inflammation, sugar levels, and a lot of the other factors physiologically that we know can increase somebody's risks of their cancer coming back or cancer metastasis. And if you have already had cancer and you want to reduce your risk of your cancer coming back, biohacking can be useful for you as well. And in the same manner, by basically reducing the promotional risk factors, the physiological promotional risk factors for cancer growth, recurrence, and progression. So as a radiation oncologist, I'm working with cancer patients every day in my practice, and I'm able to treat all sorts of disease. And one of the things that many of my patients ask me is, what else can I do besides just the conventional oncological approach, chemotherapy or radiation therapy, surgery. And so I have for a number of years been getting into the realm that is called integrative oncology. And integrative oncology combines lifestyle modification along with conventional oncological treatments, as well as complementary therapies that are evidence-based in order to hopefully improve cancer outcomes for patients and patients' quality of life. I've also added into that functional medicine, which are assay-based tests, looking at somebody's underlying physiology, maybe looking at their nutrients, looking at their underlying inflammation, their sugar metabolism, and a number of other markers. Combining all of that together is really the modern era of integrative oncology. Biohacking is where we now put on an extra component into this, and this is something that I have been incorporating into my own life and have been teaching to patients, and I think that's very useful. And this is where you can actually monitor your own physiology. I, for example, use a continuous glucose monitoring type device, which is a little measuring technology here that can measure glucose throughout the day, which is a way for me to see one of the markers that we know of that's associated with inflammation and cancer recurrence, etc. I use technologies to monitor my sleep and heart rate variability. This is a little ring that has a monitoring technology in it for that as well, and a number of other technologies that I use in order to track my own physiology and my lifestyle. When I get up in the morning, I'm looking at my heart rate variability throughout the evening, and then I may get on the exercise bike, do some exercise, get my heart rate up. I might do some weight training or potentially some yoga, maybe before work or even after work. I will always incorporate a good meal, which I'm fortunate to be able to eat during the day. And later on in the evening, when I'm reading my medical journals or other books, I'm wearing some blue blocking glasses so that I don't overstimulate the pineal gland and decrease the production of melatonin, and then go to bed and start all over. So I created this website to help not just my patients in the clinic, but everybody. And this website, I think, will be useful for educating about biohacking, about lifestyle modification, also integrative oncology topics, things that I think are really important to improve overall health in general, and that would be reducing the risks or promotion or progression of chronic diseases, cancer, cardiovascular disease, diabetes, and dementia. All of these things are intimately linked to physiology. And so I'm going to be teaching about that through this website. This is what I do in my clinic, and I encourage people to come see me in the office for a consultation. Also, I do consultations remotely through the internet. I do them through Skype or through the phone. And I also have an online course that I offer. It's a web-based training program that teaches you about integrative oncology, functional medicine, and overall biohacking. So you'll be able to access all of this information through this website.